Hey, Spoonies. Welcome to episode 4. We are your hosts. I'm Misty,
I'm Amber.
and today we are talking about how to advocate for yourself. As always, a quick disclaimer anything mentioned in today's episode is strictly for informational purposes only and not meant to treat, diagnose, or cure disease.
Also, we know battling chronic illness can be difficult. So if you find that you or a loved one are in need of someone to talk to, please reach out to a trusted resource. Or if you're in the US, you can call the National Suicide Prevention Hotline at 1-800-273-8255, 24 hours a day, 7 days a week. Again, that number is 1-800-273-8255. Let's get started. Woohoo!
Woohoo!
We're already on number 4. I can't believe it.
I can't either. It's so crazy. And so we are going to work on getting better microphones. So for all of you guys that are listening, we appreciate it. And thanks for being patient and working with us as this grows and as we build a community. We are super, I don't know, like just forever grateful of your support and that you listen and share. So thank you for that.
And that you're here at the ground floor
Yes.
in our baby steps where we're building.
Yeah, we talked earlier today and we have a lot of fun plans in the works. We probably won't share quite yet,
Yeah,
but I'm super excited. And I think in the summer, we're going to really kind of expand what we're doing, and I'm super excited about that. So
me too.
stay tuned. So, our topic today is how to advocate for yourself, which is super important, especially in the chronic illness world, especially if maybe you don't have a chronic illness, but you're just, starting to get used to, maybe getting checkups and just making sure you're on track with your health. So, it's really important for anybody in general. And there's a lot of things that took us a long time to learn over the years, and we want to share it because it's super important.
Absolutely. And
So,
this doesn't just apply to people with chronic illness. Like appointing an advocate. I mean, obviously we like to say advocate for yourself because no one's going to care about you the way that you care about you. But definitely, whether it's a trusted friend or family member or spouse or significant other, just somebody that's on your team that knows your wishes, your plans, your boundaries, all of that.
absolutely. So, if you can have a friend or family member come with you, that's always really helpful because, then you have a second person. They're going to retain information maybe that you didn't, or they can remind you to ask certain questions that you forget.
They take
For
notes.
me, yeah, for
Yeah.
me, that's not ever really been an option. Like, I've never really had people come to appointments with me. I have so many, and maybe I also deep down have a little bit of an issue with asking for help, which I'm working on. But I'm just so used to going to all these appointments alone that um, so it's fine. Everyone's gonna have a different way, whether you bring someone or not. So I mean, we're gonna share tips that will kind of help. Um, however, is gonna be your best method.
And you can always, if you don't have anyone to go with you to your appointments, you can always check with a staff, with whether it's the doctor, the nurse, whoever you're seeing, if it's okay to record, like using your voice recorder. Because a lot of times, especially if you're by yourself, you're getting a lot of information in a very short amount of time. So being able to go back just like you would if you recorded lecture from your professor, sometimes you can go
Yeah,
back and you're like, oh yeah, what were they saying? And then you can replay it, but always make sure
just
you get their permission first.
yeah. I was gonna say just make sure, because there's been
Absolutely.
times where I'm like, oh, I want to record this, and then I'm like, oh, I gotta make sure I ask for permission.
Absolutely.
um,
Absolutely.
yeah. So I mean, let's see, where do we begin? I guess um, just say, like, in general, if you are going, maybe you got a diagnosis or you're having some issues, like, we'll just start with that. So obviously your first thing you're going to do is to make an appointment. I know for a lot of us, insurance may or may not be an issue, or funds. So another thing you can do is check your resources in your area. I know for us locally here, we have Brevard Health Alliance. Um, they do a sliding scale. So if you don't have insurance or you're low income, you can go there. So, there's resources in your area. So find out what you can kind of take advantage of and what systems are available to you if you don't have insurance.
And if you do have insurance, make sure that you call and you know who's in network, who's not in network. Because a lot of times
Yeah.
when you see a physician or they refer you to a diagnostic facility, from a doctor's standpoint, they're thinking of, the best place or person they can send you to, but not always is it covered by your insurance in network. So it's really important as part of advocating for yourself to know your own benefits. So if you do have insurance, call. They're there to answer questions to find out, what your out-of-pocket expenses are going to be. You can call ahead of time and ask, request the codes, the ICD-10 codes, to find out if those are specifically covered and how much. So that way you're not walking in blind, because a lot of us know medical debt is legit.
Yeah, for real.
And it racks up really quick when you're seeing doctors as much as we do. But no, because the flip side of that is that sometimes your insurance or your supportive care dictates where you go. So that's the other flip side to think, is that it doesn't always mean you're going to get the best facility or the best doctor for your condition. It's a lot of times your insurance dictates, if you're wanting to stay to keep your costs down, that determines who you see. So the flip side of that is when you're researching specialists to make sure, for whatever it is that you're going after, whether it's in network, out of network.
And always check your bills, because I always get those bills in the mail and I'll just throw them away. But I started being a little bit more responsible and adult and opening them. And I've noticed that some of them were already paid for, or maybe they were picked up by insurance or whatever. And actually today I did that. I had a bill and I was like, this was covered. So I called and I was like, why do I have this bill? Why, it's like, you took my information. It was in the ER. And so they saw that it was in fact covered and fixed it. So, sometimes you got to really be on top of that kind of stuff, because that was like a $2,500 bill that, I did not need going into collections, that was actually covered.
Well, and I keep a separate file. So as those come in and I open them, I don't even necessarily look at them right away, but I at least open the mail, put them in the file. And then at least a couple times a month, we'll check in and make sure what I'm getting from the facilities or the doctor's office matches the explanation of benefits I'm getting from my actual insurance.
Yeah.
Because that happens a lot. I mean,
it really
happens a lot.
And I had a doctor or a radiologist tech do the incorrect imaging. It was for like my ear, like the bones near my ear. And so they didn't know what they were doing and they did the incorrect one. So the doctor was like, that's not what I was looking for. You need her to come back in. So I came in the next day and did it again, which is a pain, but whatever. And so that's not my responsibility,
Right.
to have to pay for both. So they billed the insurance for the second one, and the insurance was like, we're not going to pay for the same test.
Right.
So they sent the bill to me. And so I had to call the facility and I was like, you
guys messed
stay
up.
calm, Misty. But I was like, I had to explain the situation and they were like, well, oh no, they wouldn't pay for it. So you're responsible. And I was like, listen, you did the incorrect test. So I'm not going to pay for a second test that you messed up because you did it incorrectly. And so they fixed it, so it really is a full-time job. And, so treat it like one, because it's a lot of responsibility. It's a lot of work, a lot of information. And so another thing you can do is like on your phone, if you have the notes section in your phone, even just start like a health tab where you can put your insurance number, so you know who to call as well, as far as like
contact.
Points of contact. Put all your doctor's names and contact in there. Maybe your meds in case you forget.
Anytime that you speak to someone, whether you're calling about a bill or whether you're calling the insurance company, they have to give you a reference number. Write that down, because anytime that you have to go back and track that down to say, oh, I already spoke with someone and they told me this on this date, you have a reference number and a name to refer to, because it's super important, because they'll shuffle you around to the point where you're like, who was I talking to, or what was I talking about? So it's really important to keep track of that too.
And our last episode was about brain fog. So when you were talking brain fog, which if you missed that one, it's just basically where your brain is just foggy and it's common with chronic illness and you maybe have confusion or like ADD. It can be from medication, lack of sleep, inflammation. I mean, you name it. It's common. So when you're going to go to an appointment that you've waited weeks or months for or whatever, you only have that small little 15-minute window to see that doctor usually, most of the time anyway. And so when you go in, and then they sit down and you just totally like blank out and then you miss your appointment or your appointment's over and then you totally miss everything you're going to say. So that's another time where you want to either put it in your phone in your notes or write it down. So write your questions down. Super important so you don't forget. Write your symptoms down, everything that you're trying to cover. And you can
Absolutely.
also, while you're in there, write down what they say and their responses. So that's also a super important, thing that you can do as well.
For sure. And I mean, I'm analog, so I use my bullet journal for that, and my husband knows where it's at, so that if he needs to get to it for any type of information, if I'm passed out or if if there's an emergency situation, he can go to that book and he knows when all of my last appointments were, where all of my records are, all of that stuff. So
Definitely.
yeah.
And so, another thing I'd like to say too is I'm grateful for our medical providers, professionals, doctors, nurses, all of that. But we're all human and people do make mistakes and there's a thing called human error. And it does happen. And so, another thing I learned too is, and something I always like to enforce and tell people is we have rights to our medical records. So if you go and get an MRI or CAT scan, or maybe you're in the ER, you can go to that building, that hospital, go to the medical records department. Typically, it's from like 8 or 8:30 to 4 or 5. In 24 to 48 hours, you can go in and you can request the report. And it's super important to keep all of those. I have them in my car. I have a file thing in my car where I put my recent tests and stuff because not all doctors' offices and hospitals are connected. Not all of them have access, or not all of them have pulled your files. It's not always as magical and easy that way. So, there's been times where I come in to see my doctor and they didn't have my report, and I pull it out and hand it to them.
Absolutely.
And I say like, that's my copy. Make a copy. Make sure I get that back, and I
Yeah.
make sure I have it because it's not always available. And then the other thing is, I have seen false information on my records in the past. So, what I learned too is you can call the medical records department, ask for an amendment, and have them fix that. I've seen false diagnosis or false information, and you got to make
So
sure that they correct that.
one example would be, obviously POTS is very misdiagnosed and very missed in an emergency situation, especially if you're going in through the ER. And it gets often diagnosed as anxiety or panic disorder. And so that's a big one because the minute that you have that on your record and it's in a hospital setting, they're going to refer back to the last time you were in the ER and for what.
Yeah.
And so you really want to make sure that you're double checking once you've been correctly diagnosed, that you're always staying on top to make sure it's the most current diagnosis.
Yeah. And I had a recent incident with that. I have dysautonomia, so my nervous system gets crazy. I go to the ER honestly like at least once a month. I usually try to keep it under control myself, but sometimes it doesn't work out that way. My hospital and ER is still not very familiar. There's always different doctors, so you're not always getting the same one. Some of them are great, and some of them are just, they'll sit there, literally cross their arms, look at me, and just be like, so you have an anxiety today? And meanwhile, I'm sitting there with my heart rate and blood pressure sky high, and I'm like, come on, dude. Like,
Right.
But and so what's frustrating is, again, I go and I get all my records because sometimes they don't tell you everything like that shows up in your blood work, and then you find out, oh, my potassium was pretty low or whatever.
Right.
And so that's why I like to get my records, because I also like to see everything that was going on, so when I follow up, I'm aware. which is again super important. And as I was looking through my report, the diagnosis that they put on my file as I was discharged was anxiety. So, and the reason why I have an issue with that is because anxiety sucks. Don't get me wrong. I understand. I feel you. It's scary. It's a real, true medical issue. However, I have a lot of serious heart issues as well. And I the issue is when I go in the next time and my heart's racing and my blood pressure's skyrocket, they're just going to put me in a room. They're not going to put me on a monitor because they're going to assume it's anxiety or stress related, and they're going to shut the door and they'll get to me when they get to me. Meanwhile, I could go into, cardiac arrest or have a stroke or something because my adrenaline's going crazy and my nervous system's all out of whack. So, I'm on the phone with them. I'm on the phone with the, two different people, and I'm like, they're like, it's not a big deal. I mean, you're anxious, right? And I'm like, of course I was anxious because it's a scary situation, but everyone who comes into the ER is going to be a little anxious, and you don't diagnose them with anxiety, and I explained to them the importance of it. And that's when they told me that you can go to the medical records department and do an amendment and they'll fix it, because I need to make sure when I go in like that next time that they see like, okay, we got to get this girl hooked up on fluids. We got to do, her rescue meds and do the protocol that I do when I'm having this issue.
Right. And like we've said before, it's not to say that anxiety and panic disorders are very real. It's a real diagnosis. You just want to make sure that you're getting the right treatment for your diagnosis. You want to make sure that it's correct for you. So
yeah, because anxiety and panic disorder, you don't necessarily need a heart monitor for.
Well, and it's treated very differently. Yeah, absolutely.
Right. So, and another thing with having your medical records is there's a lot of stuff that gets left out. So in the past, for example, I had a cardiologist do a carotid artery ultrasound, and it was fine. So when I followed up with that, he was like, oh, everything was good, moving on. Well, I had the report, and the report found, while looking at the carotid artery, I found that I had nodules on my thyroid, and it said refer the patient to brain fart. What's it called again? It starts with an E.
Endocrinologist.
Yes. Thank you. To an endocrinologist. And he didn't tell me that. So if I didn't have my record, I would have just gone on and I wouldn't have known that I have, I have like 10 tumors now on my thyroid just growing away. And nobody, I wouldn't be seeing an endocrinologist or following up with that. That's just one example. Do you have any examples?
Oh, yeah, a ton. I wanted to do a quick side note, though, for our listeners. Here in Florida, you can be charged for your records. I'm not sure. I know the statutes vary state by state. Not all facilities charge you, but some facilities do. So just be prepared if you've got 500, pages of records.
Yeah.
Just keep that in mind and double check before you request it. Because here in the state of Florida, it's $1 per page up to the first 25 pages, and then 25 cents after that for each additional page. So
so what I do is I get it as I go, because then it's just a couple pages, and half the time they're just like, I just say, oh, I'm getting it for my medical records to give to my doctor, instead of saying for myself, and then they're like, or for follow-up care. That's what I say. I'm getting it for follow-up care, and then they usually won't charge me.
Absolutely.
But in the past, if you're asking for a big stack, then they will.
Yeah, and just double check. I mean, the worst, they can say is, yes, this is how much we charge, and then they'll tell you, but just make sure you do it beforehand, because I have made the mistake of being like, I want all of my records from this date forward, and then I'm like, whoa, okay, it's a big bill.
Yeah, and you can also get the actual like ultrasound imaging and the scans and stuff too, but you're going to want to usually ask for a heads up. So my cardiac surgeon, he likes to look at the echo reports himself. Like or not the report, the imaging. He'll take the report, throw it away, like it doesn't mean anything to him. He makes his own, which a couple doctors are like that, which is cool. I actually like that. They like to look themselves and make their own calls. And so, and he's in Orlando, so there's no way he's getting access to that. So
Right.
for me, it is my job to go and get the imaging. So I usually will call like the day of or the day before, and I just say, hey, I need to pick up that, and they'll get it ready for me because sometimes it takes time. And
Yeah.
then they expect me, and I'll come in and grab it.
Yeah. For sure. No, I mean, those are all really great suggestions for sure. What else? I wrote something down regarding, oh yeah, print out for your medical team. That's what it was. Brain fog is
There you
legit
go.
today. Um,
This is
I
always going to be
also,
legit for us on every episode,
oh,
so just
telling
be
you.
prepared.
Yeah. The other thing that I wanted to touch base on with regards to insurance again is medications, because a lot of times, again, doctors will suggest whatever, they think is best, and not always is it covered. So just again, double check, do your research, make sure you know what's covered by your plan and what's not.
Right. And sometimes the generic meds aren't quite as effective. And so, it can be tricky too to have, but sometimes the doctors and the pharmacists, they can kind of work with everybody and you just kind of explain to them, and everyone kind of can work as a team. I know recently I had the pharmacist and the insurance and it's just, it can be a juggling game, and that's why it really is so important to take notes and treat it
Yeah.
like a job, because be organized, have all your information, have everything documented, have your files, it's important.
And guys,
Your health.
remember, yeah, exactly. Remember that you're allowed to look at things up on the internet. I'm not saying Google diagnose yourself, but you're allowed to, research on your behalf, and you can print things out, whether they're journals or medical studies or latest, clinical trials. You can print that out and take that with you to the doctor's appointment, and you can say, hey, I was researching, and in my research I found that they're doing this new study or this new clinical trial or this new drug, whatever it is that you're interested in for your condition, and you can give it to your doctor, and your doctor can look it over, because it might be something that they're just not aware of yet, or haven't had
Yeah.
a chance to learn about yet. And so the other way to advocate for yourself is to say, like, hey, I'm being proactive and I found some information, and here you go. And it
Yeah,
just
and
kind of helps.
that can be tricky because, honestly, I think some people, medical professionals, I mean, there's a meme going out there like, don't mix up my degree with your Google search, which I
Right.
respect. Like, I get it. You work
Yeah.
hard, you put in the time and years, and we get that. But the truth of the matter is, they don't know every single thing. Not
Right.
everything's in their scope. Not everything is their specialty.
Right.
So, for the patient to do a little research to kind of help get a few more answers, because the doctor only has so much time and doesn't know, the full background, and maybe they're not a specialist. And this is how I like to put it. So, I'm a hairstylist. I hate doing perms. I'm very good at them. I'm fast at them, but I hate to do them. So the the thing is, and so I haven't done a perm in a long time, and I try not to take them. So my point is if you want to come and get your hair done, and you want, I do like the rainbow hair and stuff. So if someone wanted to get rainbow hair, they're not going to go to a place that does like perms and roller set, and specializes in that, right? Because it's probably not going to come out right. Probably not going to be the best job. You want to go to someone who specializes in that particular service or style that you're getting. And it's the same thing like with medical, So if you even seeing a neurologist, you might see a neurologist and be like, hey, this is a neurological issue, but that doesn't mean they specialize in your neurological issue. And a lot of people with, for example, dysautonomia, they're in this gray area, and they go to see a neurologist, and they're like mine, for example, they specialize in migraines and seizures. Dysautonomia is not his specialty. And so, what really is admirable is when a doctor can just really be frank and honest about that and just say, hey, you're out of my scope, and I just don't really know how to take this on, and maybe recommend you to go somewhere else. Or like
That's
my
really cool.
neurologist, he's very open, and I've printed out, like Amber said, I printed out stuff and I brought it into him and I said, hey, this is what, this is where we need to be looking. And he's doing his homework and he's working on it, which is great. Like, he's stepping outside of his comfort zone. And so,
And
you
all you
really
can do
gotta,
is try. I mean,
yeah,
if you have a willing doctor, they're not going to take it, everything's about presentation. So it's just like anything else. I mean, no one's going to care about you like you. Your doctor has an obligation to care about you, and you know, most of them are amazing, but it's not to say that there aren't not very good physicians out there.
yeah,
It's not
there's
to say that
definitely
there
going to
aren't.
be some that are going to be offended and just be like, "Excuse me, are you a doctor?" And they're
Right.
not going to take it. But like my friend Kendra said to me something that I'll never forget. She said, "Finding a good doctor is like dating. You're
Mm-hmm.
going to meet doctors who you're not gonna mesh with, or you're not gonna see eye to eye, and that's fine. Like, just don't give up. Like, some people." They'll go and see a doctor, have a bad experience, not get anywhere, and they're done.
Well, here's what kills me is that you get labeled for doctor shopping, but you don't just go, most people, I shouldn't say all, but most people don't just go to the car dealership and buy the first car they see. So
Right.
here
But
you're
with your
talking
health,
about your health. You have one body. That's it, one body. You can buy more cars. Yet people put more research and shop around and do price comparison. You absolutely can do that for physicians. You can get
great
an opinion.
example.
You can get an opinion if it's a doctor that doesn't mesh well, that's not along, you know, isn't respecting where you want to, maybe you want to take a more natural approach. Maybe you want
Yeah,
to, try something more experimental, whatever way, because it is your body and your health ultimately, and you're the one that's affected by those decisions. If that doctor's not on board with trying that, then you find a new doctor. It's okay to do
absolutely.
that.
And an
Absolutely.
example of that, I've got many of those too, because I've been seeing the doctors my whole life. So just in the recent, my recent example is, so I'm getting over pneumonia. So when I did episode 3 and I sound like crap, that's because I was starting to get pneumonia. Um, and so I've been sick for a good month now at this point. And I went to see a doctor in the beginning where it was just in the early stages, and they gave me an antibiotic that wasn't even the right antibiotic. Took it anyway. Um, a week later, things got really bad. They got worse. I ended up going to the ER because I was kind of hoping they would do an X-ray. My doctor couldn't get me in, and I knew something was wrong. And so, the doctor literally saw me 5 minutes. He was like, "Well, they shouldn't have given you that antibiotic. You need a Z pack, your steroids, and an inhaler," and sent me out the door. That was it. Like, not even 5 minutes, in and out, no blood work, no chest x ray. Well, I continued to get worse. And now here I am. I've seen two doctors. Actually, I even saw my cardiologist, and he listened to me and didn't even say anything. And so that's actually three doctors. So now here we go. And I'm thinking, oh my gosh, I still feel horrible. My mom's telling me I'm worse. She's saying to go see another doctor. And in my head, I'm thinking, I'm crazy. I would be crazy to go and see like a fourth doctor at this point. But I did it because my gut instinct was just like, you know what? Let's do
Something's
it.
not right. Yeah.
So I went to the urgent care because my doctor, again, she couldn't get me in. And I went to the urgent care and I was like, listen, I'm not getting any better. I have heart issues. I have a lot of health issues. I want peace of mind. I want to make sure. And so he did an x ray. And guess what? I had pneumonia. So then I
Mm-hmm.
got my third antibiotic. I had a shot in the butt. And here I am. So, I mean, that's
On the
an
mend,
example.
finally.
Yeah, getting there. And then in the past, even just with my pacemaker, I had to go and get a third opinion to get my pacemaker because my electrophysiologist of so many years, she was just so against me getting a pacemaker because she just wasn't convinced. She, very old school. She didn't think that I could have what I have because, I already have a congenital heart defect that's rare. I have an extra pathway in my heart, WPW, which is why I've had all these arrhythmias. And so I don't think she thought there was a way that I would have another thing going on. And she even said, she's like, only a small amount of people have that. and I'm not convinced it's you. And so she didn't even want to try, didn't want to test. I'm having bradycardia. I have 50 pages of atrial tachycardia, ventricular tachycardia, even SVT. I mean, just insane. I mean, I was like, am I crazy? I even showed like nurses and EMT friends and an ER doctor that's in the family, and they were just like, yeah, that's not right. So I saw this other guy, an EP, electrophysiologist, and he was like, okay, yeah, I'll take you. Come on in, ready to take me. He looks through my chart and he realizes that I was seeing her, and I guess they're buddies. And he was like, oh, no, 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 I'm not touching her patient. Done. He was done. And so I was like, okay, now what? So I found a third guy and I was like, listen, please, 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 I can't be living like this anymore. Like, help me. And so he did the tilt table test finally, and it induced an episode, and I had a severe cardioinhibitory response. And then along with my Holter monitor, 30 pages, he said you need a pacemaker. So, I mean, sometimes you do have to shop around, and
Absolutely.
it's because, the politics in it, maybe like, the two doctors knowing each other, not wanting to step on each other's toes, or maybe because
our favorite, you're too young to be here.
right, or they're just
So,
not convinced because
yeah.
you're, like the whole zebra thing.
Or like
They
one
are
of our, no, go ahead, sorry.
the zebra thing. So doctors are trained when they hear hooves to look for a horse, not a zebra. And so if you're a zebra, you're going to be dismissed more. And so that was my case, is I was a zebra, and she was like, no, 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 you're a horse. I only have horses come through my door, And so that's why it's important to keep trying.
And it's not just that we're too young, because one of our awesome community members pointed out, a lot of times if you're in the older, more seasoned age group, it gets dismissed as old age. So there's age bias no matter what. I think everyone, feels some sort of discrimination at some point, whether it's, age or whatever, but it goes either way. It also goes if they suggest a medical procedure or something that it's not sitting right with you, you can get a second and a third and a fourth, however much time and money, that you're willing to put into it or can put into it. You don't have to just take whatever they throw at you. You absolutely, because when they start taking things out of your body, you can't put them back. So these are heavy decisions. These are big decisions. A lot of these medications are very, very serious, so you're allowed to research and you're allowed to ask questions, and you're supposed to ask questions. If I was a physician, I would be more concerned if you didn't have questions. So
yeah, and it's important too, because these are big decisions. So, for example, I don't know if I'm saying it right, a labral hip tear. And so I was having issues like so often, and then I don't know if I was like re-tearing it or what. I thought I was just having flares, and then one time it just didn't go away. And so, having a hip surgery was just not an option for me, like no way. And so I did the physical therapy, and by the end of my physical therapy, like I felt so much better. I haven't had issues since. I'm so grateful that I took that option first, because I can't imagine going through that. So, and like you were saying too, with medications and stuff, super important to, just do your research and ask, because a lot of times, again, like, doctors are great and all, but they don't have the time to sit there with us all day. We can't always email and call them, and some of them don't even have portals and do that. So, it's not like a friend where you can just be like, oh, hey, I'm feeling today,
right. It'll be nice if it ever gets there, but
oh
but I mean,
gosh.
I had that happen with a medication, because I was doing a lot of research for the fibromyalgia pain side of things for me, and I had been reading everything and talking to support groups, and stumbled across a functional medicine doctor that actually had used low dose naltrexone as a way to treat, and block some of those pain inhibitors, and so, or pain receptors. And so I casually mentioned it and said, hey, like, I don't want Lyrica. I don't want these strong, crazy drugs that have like 20 more side effects. For me, it wasn't a right choice. So would it be possible to try low dose naltrexone? Here's the research on it. Here's where I got the
Yes.
information. And I walked out with a prescription because she said, hey, you know what? If you've done this research, I have heard a little bit about it. I don't know a lot about it, but if you're willing to try it over these other, more serious drugs, let's start with the least invasive first. So,
Yes.
but that's why she's on my medical team, because I went through firing a lot of people because it was just not, if you're not even willing to work with me and respect my choices to be a little bit more conservative, then we had to break up. We're not a good
Yeah.
fit.
And I
So,
think, when you come in and you have your records and your notes and your questions, it's just going to make your appointments go that much, better because, then your doctor also knows that you're smart and accountable and you're advocating for yourself because,
yeah.
I know like for, my doctor in the past, when I started doing that and I came in and I was reading my records and I was like, oh, that's funny because I have my ER blood work from last week because, she was trying to say it was anxiety, but I was like, I highlighted everything flagged and I was like, look at all these issues.
Right.
Why it does anxiety cause a low this and a high that and low this? And I was like, yeah, let's go ahead and look into that. And I was like,
Yeah.
also, let's go ahead and test to see if I have any type of autoimmune or vitamin deficiencies. And so she did it. She ordered the blood work because at first she didn't want to, you
Yeah.
know, until I
Yeah.
set my records down and I was like, I think we should.
And it's okay to ask. And I think it's time to be done with the shame that comes along with being the advocate for yourself. Doctors are busy and they're working within a very messed up model right now, and that's not their fault. That's another topic for another day with regards to, insurance and healthcare, but you can help them help you. And so, you might not be a doctor, you might not be in the medical field, but you can absolutely be an advocate by being prepared, by knowing what you want to ask for your appointment, and by, bringing someone with you that if maybe you get a little bit shy. I mean, I get anxious. I mean, I'm married to a doctor and I still get white coat anxiety. I just don't care for doctors. So it's
And
nice to have someone, there to support, that can kind of be
yeah.
like, oh, weren't you mentioning something, the other day
Oh yeah.
about
It's
whatever. So
also I also feel like it kind of helps with like accountability too. There's been
absolutely.
times where like I was in the ER and the doctors would say something and, um, or then maybe they weren't doing the right thing. And my husband, was able to step in and say something because I couldn't. And, or just
Hmm.
having another person kind of back me up, it is helpful. So, I mean, that's why it's important too to just kind of to do your research and to be really familiar because I mean I have had people who have reached out to me that are like oh I'm trying to figure out what's going on with me and blah 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 and like, they see a doctor and they're like they gave me some pills and said whatever and I'm like oh what medication did they give you oh I don't
Right.
know
Right.
okay
Right.
well what did they say you had oh I can't remember and it's like you got to know, like you got to write this
Yeah.
stuff down. It's like it's really important because your doctor only has so much time, like I said, to tell you stuff. Like, I mean, sure, maybe some of them might do a printout for you to kind of read over and they might give you a little bit of instruction, but at the end of the day, this is your life. So
Hmm.
if you find out, for example, let's say you found out you're celiac and then they just tell you, hey, avoid wheat or whatever and send you out the door. There's
So
so much
much more
more that goes into
complicated than that.
that.
Absolutely.
Like with celiac, for example, it's very common to have vitamin D deficiencies.
Hmm.
And so there's a
Yeah.
lot of,
Malabsorption.
oh yeah, you're the one who knows all this stuff
Yeah.
because you're the one who should, because I'm not, you're the one
No.
who, but
But I
I'm
mean,
just
it
trying
goes
to
for
pick an
no,
example.
and it's such a great example because that's the beautiful thing about what Missy and I are trying to do with this particular platform is that
Hmm.
creating community, and there's so many communities, like wonderful communities out there. We're not the first to do this, we will not be the last. But with regards to leaning on community, ask your support groups, join support groups, whether that's online if you're, homebound, or, do a little research that way. But those groups, I have gotten so much wonderful information and resources just from people that have already been there that are like, look, hey, this worked for me, this didn't work for me, add it to your list. So
Yeah. And,
those
and
are
doing
really great.
research is super important too, because, I love my groups, but occasionally sometimes too I do see some false information. If
Absolutely.
people are trying and maybe they mix things up or whatever, it happens. But
Absolutely. Yeah.
so say like I said, you have celiac disease and you don't really you only know a small little percentage of what your doctor had mentioned. So doing your own research to find out like how to change your lifestyle. Another thing that I actually told you in the past, speaking of being a hairstylist, I was like, they use wheat in
Mhm.
hair products. So,
Yeah.
what's in your shampoo? And you ended up
Which was
switching up the
crazy
shampoo.
because I
And that,
didn't know why my hair was falling out.
yeah, and that made a huge
So,
difference. So,
yeah.
there's all these little tiny factors like the vitamin deficiencies and stuff that kind
Yeah.
of go hand in hand that you can kind of put the puzzle pieces together when you go home and do your homework and your
Right.
research, to find out more and more.
And then you are
So,
armed when you double check with your medical professional because your medical team is ultimately the one that you're entrusting with your healthcare. So, advice from everyone else is great. Advice from us is great, but it's just advice. It's just what's worked for us. It's not meant as any type of, medical guidance that you always want to make sure, which the more prepared
yes.
you are, you take it to your healthcare team and
And
just
I
make
think
sure you
I
build a good team.
Exactly. And I think I say this in every episode, and I probably always will, but nothing is one size fits all. And
Correct.
so that's the other thing too. There's a lot of times where it's like, again, we'll use celiac as an example. It's like, here's your diagnosis, out the door you go. But again, everyone is different. Everyone
Yeah.
has, different things going on. They're made up differently, different DNA, genes, whatever, however you want to paint it. So
Yeah.
everyone's going to be a little bit different. And
Right.
you know, sometimes these things also get lost. Like
Right.
someone, for example, maybe they have an autoimmune disorder, but they don't know which one. Well, really, there's not always necessarily like a clear black and white reason what one you have or why. It's
Right.
kind of a little bit of a process of elimination. You know, some things maybe stick out more than others. Other things, it's just like it's probably this. So, there's a good chance too that that might not be 100% accurate because, like I said before, misdiagnosis is 1 in 20. So that's
Mhm.
12 million per year misdiagnosis. So it's also important to keep following up, keep on top of whatever's going on and keep a journal and see if the things
Well,
aren't working and retest if you have to.
yeah, absolutely. And another thing to think about is that, we're not taken care of by one physician anymore. I mean, we're passed around to specialist to specialist to specialist. I mean, think about even when our parents and grandparents, like they had one family doctor and they knew everything about them. They knew, they went from delivery to death. And
And
so,
knew their dog's name and
yeah, like went fishing on the weekend. So, I mean, you had a different kind of investment there that I think part of what's broken with the model now, that doctors just can't get that intimate anymore because it's just impossible with patient load. But I think that that's where advocating and making sure that you're prepared, like Misty said, and having all of those records and having, everything together so that when you do get handed off to a specialist, that you can give them the tools, to help them do what's best for you. So, you know,
yeah. And that's why it's also important too to have all your information and records because things again get lost because you are seeing other doctors and not all of them are connected. I know some of my specialists are under the same system and some aren't. And
right,
especially the ones that aren't in the same county. I mean, not everybody has access. I mean, there's times where
right.
they can call the hospital and say, um, hey, I need those records, and be prepared and they'll get it faxed in right away and have it. But that's not always the case,
Right.
you know?
No, absolutely.
Yeah. So, I mean, and that's why all of these things are super important. And again, we're on social media. Instagram is also a really great way, or email to get a hold of us if you ever have any questions and if you ever want to
Yeah.
reach out and
Direct
you're like,
message us.
hey,
Yeah.
this is my situation. We'll be glad to give a little bit of guidance for sure.
And guys, advocating for yourself isn't just with your medical team, it's also with your friends and family. Because part of advocating for you is being able to ask for what you need. And if it is more help around the house or with the kids or, being able to take a nap or rest or, communicating with your family that, maybe this isn't getting done or you need a little help with that. Part of our advocating and you know, making sure those boundaries are in place is asking for what you need, because they can't
Right.
read your mind as much as we.
Yeah, and I think that's also why Amber and I are. It's so important for us to, talk about, invisible illnesses and health issues and education, advocacy, everything that we're doing is because, of our background and our stories. And the reason why is because, a lot of people just don't understand. I mean, it was really hard for me I just really only started talking about my health at this level, I would say, in the past year, maybe 2 years. I was always really kind of scared. I was kind of built not to, in the past, I've had exes tell me I was a hypochondriac, or even, uh, think it was all in my head, you name it. So when you hear that all the time from people, like you're being too negative or complaining all the time, it kind of trains you to be quiet. And also because I was a hairstylist, I noticed when I did say anything about my health, my clients would kind of fall off, go away, go somewhere else because they don't want to go to they didn't want to bug me, or, oh,
Right.
she's probably too ill, I'll go somewhere else. And so, you know, now because I'm not really working like I used to and stuff, and my health is kind of my main focus, that's also helped me to finally open up about it because my clients are kind of dissipating, and that's I'm okay with that now because I physically can't work like I used to. So that's
Absolutely.
also kind of helped me to speak about it. Otherwise, I probably would still be quiet.
Right.
Um, but our post today um, was, which is on at the Invisible Diaries on Instagram, is if you cannot connect the issues, think connective tissues. And so that's not always, again, a one size fits all for everybody, but um, it for me. So I have Ehlers-Danlos syndrome, and it took me up until I think 32 years, I guess, to kind of get an answer and a diagnosis. Um, and so a lot of people with like connective tissue disorders or autoimmune, even, a lot of these people will be told that they're hypochondriacs or fall on their head. And this is where they kind of start getting dismissed by not just loved ones and family members, but even doctors,
Yeah.
because that's part of having an invisible illness, is it's just not quite as obvious, or
Well,
maybe it's not
remember,
something that always shows up in your basic blood work.
that's the thing, is a lot of these don't have definitive ways to test. So like even for my interstitial cystitis, there's not a definitive way to be like, you got it this way and this is exactly what you have, because it's such a graded scale. So there are a lot of doctors that still don't even acknowledge that it's a real medical condition. So, and the more I research, the more I'm finding that it's there's a lot more to it. And thankfully I had another physician on my team that stepped in before I made a very terrible mistake following a specialist, because I wasn't thinking outside of the box. And so that's the other, a lot of physicians, and not to say that there are, again, a lot of brilliant ones out there that are doing amazing things in the world of autoimmune, but there are a lot, because it doesn't check off so nice and it doesn't fit in all of these boxes so pretty, that they don't want anything to do with it. So that's okay. That just means that doctor is not for you.
Right. Just like I was saying before, is your doctor a perm specialist, or can they do
Right.
rainbow unicorn hair? What do you
Right.
need to get done?
Right.
Just think of it that way. Um, so with the connective tissue disorders, what they're finding is, it's known to be rare, but what they're finding is that it's actually rarely diagnosed. And so that's what's so important about raising awareness and advocating for yourself, is that none of these doctors that I've seen knew what Ehlers-Danlos syndrome was until they met me. I didn't even know what it was at first. I think I was just so desperate to find answers that I started ruling things out. I had, with all my blood work and all my symptoms and stuff, I literally went through a list and I was like, okay, do I have this? No, let's
Mhm.
cross it out. Do I have mono? Do I have lupus? Do I have celiac? And we just went down the list, started crossing things out. And then eventually one day, when I stumbled on Ehlers-Danlos syndrome, Actually the first time it was mentioned to me, and I was like, I don't think that's it, because the picture they show someone's like all crazy, which actually I can do. But I think it was because it was so extreme, um, that I was like, no. And so I really dismissed it at first until I came back across it, and I kind of started like looking into it more, like, well, maybe I am hypermobile. I have always been double jointed. And then I started doing the bait and scale, where you do like the
Mm-hmm.
thumb, or if you have the video, you can kind of see.
Yeah.
Unless you're on the podcast, you can hear. So I started like realizing, like, ew, look at this.
Yeah.
And
All
turning
the fun
my
tricks.
all the party tricks is what they call them. And then
Yeah.
I did the bait and scale just myself at home, and I was like, oh wow, I was like a 8 out of 9 or 9 out of 9. I think one of them was a little hard because of like stiffness, but then I thought, well, this could actually be a real thing, and that's kind of what started it to my journey of getting my official diagnosis. So that was me. That was
Right.
me doing the research and me going to the doctors, and my doctors still wouldn't even do it. They didn't even know how to do it, and I couldn't get to a geneticist. So I had to do it through my children.
Right.
I was like, well, my if this is hereditary, then in my kids, and so I started looking at them in a different way, and I realized,
Mm-hmm.
okay, so the pediatrician was actually familiar with it. They went and got echoes. They have mitral valve prolapse, which is common with it. And then, they had the joint hypermobility. And then we went to the geneticist and had the genetic testing. And so that's how I was able to kind of finally get confirmed. And they tested me through the kids. So the
Yeah.
kids' insurance paid for mine. Because, and that was the route I had to go,
Right.
all because my doctors weren't sure of it. So again, like Amber was saying earlier, printing stuff out. I saw my neurologist recently. I printed out a list of all the neurological comorbidities that go along with Ehlers-Danlos syndrome, and kind of explain, like, these are some issues that I think could be contributing to my dysautonomia that we're going to kind of look into now. So, you know, I hope that this has been informative, and that, people listening can kind of get a better idea of like our journeys, and how we got here. And it was hard work. It wasn't easy. We,
Yeah.
we worked hard, and we had to be very persistent and do our homework. So, homework,
Yeah.
homework, homework. That's going
Homework.
home, researching,
And don't
go.
carry shame. Do not carry shame
Exactly.
for other people's, misunderstanding of what you're going through.
Yes.
So, stand up for yourself. And if you are feeling not so strong, then reach out to this community, and
Yes.
we got
I
you.
was
We got
gonna
your
say
back.
that. Yeah, if you have family members or friends who are just dismissing you, and they're trying to say that it's all in your head and you're a hypochondriac, don't let that get to you. I mean, I know it's hard, but like, reach out to your community. I know we're kind of in a way strangers. We're on the internet. You don't really know us in real life, but like really, like build these relationships. Reach out to people who are maybe a couple steps ahead of you in their diagnosis or journey, or whatever, and
Yeah,
make friends, and join support groups, because you're going to learn so much more um, this way than you are sometimes with the doctors, you know,
absolutely.
and
Absolutely.
having these
Strength
friends
in
and family
numbers.
members, yeah, having these friends and family members who tell you it's all in your head, and that, just it's it's not it's not going to put you in a good place. So that's why it's so important to kind of just like reach out, and build your own
And
little
talk
tribe.
about it. Yeah.
Yes,
It's okay to talk
definitely.
about it. And it's okay to ask for help, and it's okay to admit if you're having a hard time, just take that step and ask for help, or reach out and connect.
Yes. And so if you go onto our social media, our main platform that we kind of focus on a lot is Instagram. So you can go to at the Invisible Diaries. We also do have a blog. It's not a .com yet, but we it's linked there. And if you want to subscribe to it, we will pretty soon in the future start pumping out some blog posts that will be pretty cool, especially in the summer.
Yeah.
That way, if you prefer to read instead of listen, we'll have some good posts coming out there. So subscribe, and then subscribe on iTunes. If you don't have iTunes, we also have a link for Buzzsprout. We have Facebook. Yeah.
Yeah. Reach out and even just say hey. If you don't need anything, you can just say hi.
Yeah.
We like
And
highs. Yeah.
and if there's any like specific topic that we haven't covered yet, I mean, we're only on our fourth episode. Again, feel free to make a request if there's something that you're just like getting into, you want help or a little guidance or to learn. I mean, we'll even bring guests on the show. We can put other people on our podcast or on our YouTube. So if we have someone who's like really more of a specialist in, for example, like cystic fibrosis or something like that, we can bring someone on that can who's a great advocate for that and answer some questions and, say a little bit more than we would know.
Yeah, absolutely. Yeah, we've got a lot of big plans. I mean, like again, thank you guys so much for hanging with us while we're in the infant stages, and we know that it's rough around the edges and we're getting there, but you guys are with us on a journey and we're figuring out as we go as far as production and stuff. But we've got a lot of exciting things coming up and we cannot wait to share them with you. Because it's going to
Yes.
be really, really good. But everything takes time. All good things take time.
Yes.
So stay tuned for
Awesome.
sure.
All right. Well, thank
All
you so
right.
much for listening again
Absolutely.
and being a part of this. There we go. I was trying to find out how to stop it. But yes, thank you so much.
Yes. Thank you guys.
Bye.
Bye.